Hey everyone, I'm back with another article on gabapentinoids. This one comes from Pat Anson, PNN editor. That's Pain News Network. They seem to have some really good stuff coming out here. This one is titled Gabapentinoids Raise Risk of Suicide and Overdose in Younger People. It's a short article and it reads, Gabapentinoids, a class of nerve medication widely prescribed to treat chronic pain, increase the risk of suicide, overdose, traffic accidents, and head or body injuries in younger people, according to a large new study published in the British Medical Journal. Cells of the two main gabapentinoids, pregabalin, Lyrica, and gabapentin, Neurontin, have tripled in recent years in the United States, where they are often promoted in prescribing guidelines as safer alternatives to opioids. And I can tell you, in the United States, they're being widely used in addition to benzodiazepines, sometimes to help treat anxiety and help people come off benzodiazepines. As I've said in other videos, this can have really bad effects. I mean, you can become completely strung out on these gabapentin, and even after you come off the benzo, you're just left in a wretched state that's very similar to post-withdrawal and benzos. A team of research followed nearly 192,000 people enrolled in the Swedish Prescribed Drug Register who filled prescriptions for gabapentinoids on at least 2 consecutive occasions from 2006 to 2013. That information was compared to data in the Swedish Patient Register, which collects information on hospital admissions and outpatient care, as well as the Swedish Cause of Death Register. Over the study period, researchers found that patients taking gabapentinoids had higher rates of suicide or suicidal behavior, 5.2%, unintentional overdose, 8.9%, traffic accidents, 6.3% increase, and head and body injuries, 36.7% than the general population. The head and body injuries, that's an interesting one. I mean, here you would think just people were getting messed up on the drug and falling and hitting their head on something, right? The risks were stronger for people who were prescribed pregabalin and were most pronounced among adolescents and young adults aged 15 to 24. Patients aged 55 and older taking gabapentinoids were not at a greater risk. So that's interesting. Maybe they're just more responsible. Researchers believe the drug may have more impact on younger people because they have faster metabolisms, which could lead to withdrawal problems that affect their impulsivity and emotions. Researchers believe the drug may have more impact on younger people because they have faster metabolisms, which could lead to withdrawal problems that affect their impulsivity and emotions. Overall, gabapentinoids seem to be safe for a range of outcomes in older people. However, the increased risks found in adolescents and young adults prescribed gabapentinoids, particularly for suicidal behavior and unintentional overdoses, warrant further research, said lead author Sina Fazel, medical doctor of the University of Oxford in England. So they want to look into this more. If our findings are triangulated with other forms of evidence, clinical guidelines may need reviewing regarding prescriptions for young people and those with substance use disorders. I agree with that, absolutely. Further restrictions for off-label prescriptions may need consideration. 100% agree with that. Again, they're using it for benzo, and these guys are not very educated on what benzo withdrawal is, what it looks like, what it can do to people. I mean, it's amazing to me that somehow benzodiazepine withdrawal still seems to be the elephant in the room, or just some kind. It's Bigfoot. You ask any doctor, it doesn't do that. We've never seen it. It's unbelievable. Pregabalin is approved by the FDA to treat diabetic nerve pain, fibromyalgia, post-herpetic neuralgia caused by shingles and spinal cord injuries, while gabapentin is approved for epilepsy and post-herpetic neuralgia. Both drugs are widely prescribed off-label to treat back pain, depression, migraine, and other chronic conditions. I personally was prescribed it for back pain, and I wouldn't take it. Gabapentinoids are increasingly being used recreationally by addicts who have found that the medication enhances the effects of heroin and other opioids. The drugs were recently classified as controlled substances in the UK. Gabapentin is not currently scheduled as a controlled substance by the DEA, while Lyrica is classified as a Schedule 5 controlled substance, meaning it has a low potential for addiction and abuse. Again, I disagree with that. A recent clinical review found little evidence the drug should be used off-label to treat pain, and that prescribing guidelines often exaggerate their effectiveness. We heard this in the other article. The CDC's controversial opioid guideline, for example, calls calls gabapentin and pregabalin first-line drugs for neuropathic pain. Despite documentation that these drugs were promoted improperly for off-label treatment of pain, the recent rapid increase in prescribing of gabapentinoids suggests a persisting sense among clinicians that gabapentinoids are highly effective pain medications, wrote Christopher Goodman, medical doctor, and Alan Brett, medical doctor of the University of South Carolina School of Medicine. Guidelines and review articles have contributed to this perception by often uncritical extrapolation from FDA-approved indication to off-label use. So you see the medical community is having a disagreement a little bit here, risk versus reward. It seems that the prescription protocol needs to be reevaluated, absolutely, especially amongst younger people. And, doctors use a lot of offhand liberties with drugs, and when you're dealing with stuff like that, these offhand stuff, that a lot of times most times they're not undergone the great testing and research that the drug was intended for. We just go, let's try gabapentin. Yeah, let's try for depression. What? Why? Back pain and its correlation, and do it. And doctors, they're kind of exempt from being sued or tried in court of law during these situations. I mean, as psychologists, we have so much guidelines. I mean, we have to prove that we have to have, a lot of times we have to have clients fill out forms so we can show the insurance companies, look, they came in reporting an anxiety level at 8 and now I got them to 6. And even then, insurance companies only want to pay for a limited number of sessions. They don't deal with the Freudian, Jungian psychodynamic models anymore. They just want CBT and behavioral and, fix them in 6 weeks. And this is all scrutiny and pressure that came down from the medical the psychiatric associations. Not to demonize them. I think psychiatric medicine is wonderful and has a lot of value, but it's also, in a way, still kind of the Wild West in a lot of this stuff. They're just throwing stuff against the wall and let's see if it sticks. And then everybody's got an agenda. So if something doesn't work, we don't want to admit that it doesn't work. If something works better in psychology, you see a lot of trends where psychiatrists don't want to refer people to psychology. They downplay the effects of psychology. They overplay the effects of mental illness and as being solely a chemical phenomenon. You've got a chemical deficit, while at the same time admitting in other journals that talk therapy, mindfulness, CBT, all these things can reprogram the thoughts and therefore the behavior and therefore, by extension, the chemistry. And what I'm saying is talk therapy works in a similar way that it can reprogram our chemistry. They acknowledge this, but this isn't what they do. I talked to a psychiatrist and I asked him, why don't you refer your clients more to psychologists, and why do you overprescribe so much? And he said, well, when they come into my office, they expect to leave with a script. I mean, simply put, he didn't argue about it. He said it with 100% confidence. That's what they come for, and that's what they're going to get. And why would I refer business away? I don't, sometimes maybe I'll tell them if it's, something minor. A lot of people don't. And you have situations where people are just going through something, a divorce, change of life, and it's really crappy, for lack of a better word, to see them get put on a drug that could really affect their life, and something they probably will take for the rest of their life. So anyway, there's a lot of disagreement going on right now in the Psychological Association and Psychiatric Association, Medical Association regarding gabapentinoids. And I suspect we're going to continue to see more articles like this come out, more research come out like this, and the push for better prescription protocols and tapers and whatnot. Again, if you guys have any thoughts, let me know in the comments. Click like, subscribe, and I'll talk to you soon.